If you've been struggling with strange symptoms like sinus issues, vertigo, ear fullness, visual changes, headaches, and you have neck pain or stiffness, the hidden cause is probably your upper cervical spine. In this video, I'll explain why this area of your neck is so important, and I'll show you 2 simple treatments that you can do that's total game changer for how you will feel. So first, let me share some symptoms that we've noticed with some of our clients when they have neck stiffness. They could have visual changes where literally they can't see, like it's the side where they have the tightness is where they're having some like blurred vision type stuff. We've seen that. We've seen sinus issues improve with the nose. We've had clients that have had like weird smells. You just get some weird symptoms. We've had clients that have had TMJ stuff, headaches, ear issues where they feel like it feels full or like there's fluid in there. And there's all sorts of different symptoms, vertigo, same kind of thing. So there's all sorts of different types of symptoms that we feel that actually could be coming from the neck. So why is this getting missed? This gets missed because most people will go to the side of the issue. You go in and you think that, oh, it's only a nose issue, or it's only an ear issue. So you go to someone that specializes in the nose, that specializes in the ear, and that's the only thing that you tell them about. But you don't tell them that you have vertigo, and you don't tell them that you have neck tightness, and you don't tell them like all these other different things because you don't feel like they're all connected, because it's like, no, it's just a nose issue. And it's often why it gets missed, and it's also often why doctors don't ask enough questions because they specialize in one area, and that's the only thing that they're going to look at to figure out like what is going on. And so it gets missed so many times. So how does this happen? How does it work? It's all comes from the upper cervical spine, which is literally like right here. Here is part of my upper cervical spine. So I have my hand on my skull here, and just down from that is where that upper cervical spine is located. And so because it's located here, it refers this direction in through the area. Much like your ribs will refer through here, your shoulder, when you get into the neck through here, your shoulder, it can refer into the shoulder, but the upper cervical will go to the ear, it can go to the jaw, it can go to the nose, it can go to the eyes, because it hits all in these different areas. So this is why it matters. And it matters if you aren't moving, then muscles will tense up and protect. They tense up and protect. They can hit nerves and blood vessels, which can create weird random symptoms that happen that's unexplained. So that's one thing that it does. You also can get it from just muscle tension, or from the joint doesn't move. You get the muscle tension and you'll get referral patterns that happens. Much like if you had a scratch on your arm and it's really irritated, it's going to refer pain all the way around that arm. For different body parts, where it refers into is different areas. So like for the neck, it refers in through here. So when we're looking at someone that comes in, oftentimes they're coming in because of something else. They don't realize that that their nose or their ears are a part of what's going on with their neck. But when we start asking questions, is there anything else that you're noticing? And we share stories, and they're like, oh my God, I have this, and the testing came back negative, the doctors can't figure it out. Like when you start hearing those things, you're like, and they have neck stiffness or neck tightness, you're like, oh yeah, these are all probably related. So if you have 1 or 2 or 3 symptoms that we talked about above, and you have neck stiffness, that's the key, and you've done all the testing and everything's normal, it's probably coming from your neck. So that's what we're going to talk about today, and we're going to get into some exercises that we can do. So how we test it, I'll just kind of show you on me. You have 2 areas where we get rotation from in the neck. We get it in the upper cervical spine, and we also get it down at like C5, C6, C7, around there. And so we want to take out the C5, C6 area for that rotation and just see what the rotation looks like in the upper cervical spine. And so when we take people, we'll take their head and we'll flex them like this. And so when you flex them, you are basically taking out the lower part of the cervical spine, and then we can go in and rotate them one direction, and then we can go in and rotate them the other direction. And what we'll find is one side will be like, yep, that's a little bit tighter compared to that side. And so that gives us one indication that we know, oh yes, the upper cervical spine is a problem. Now, we do a lot of manual work to really work this area out and get you fast results, like usually within a visit or 2 or 3. It just depends on all the things that we find. We usually can get some sort of results on these weird symptoms. And so this is something that it's not like, gosh, you have to come here 15 visits before we figure it out. Usually within 3 visits, we're going to be pretty close to like, okay, yeah, this is opening up. Your neck is doing better. Yeah, your ear's getting better. Yep, your nose getting better. Oh, great. Sinuses are better. Awesome. So we kind of know they are connected. If the neck is getting better and there's no connection between all these other things, we've ruled out the neck, and we can start looking at other things that potentially need to happen. So the exercise that you can do to start out, the first one I put people on is, this is called a suboccipital pad. They are amazing. I like this one because they have small, like these are like little small fingers that you're gonna basically put at the skull, the base of your skull. And so this can really help release some of that tension for us to improve some of that mobility, which we're gonna do a mobility exercise that I'm gonna show you after that. So what you'll do is you're gonna take this and you're gonna hit the very tippy top of the skull. So it's back here. So you can feel that's the skull. You're gonna go into the soft tissue part just below it. So I'm gonna go and hit it right below. And then what I'm gonna do is I'm gonna almost kind of push into it, and then I can take my head, like my body, and I can push, like, so I'm gonna push with my legs to push this way to really help release. Now, oftentimes what we find is one side's tighter. So let's say this left side is tighter, then you can tilt your head slightly more this direction to the left to put a little bit more pressure on that left side. You will feel it, and you just hang out here and just kind of breathe. This will help us improve a lot of that muscle tension that you're noticing, so that we can start working on getting that mobility back, which is what we'll do next. Again, a lot of times if you can get into someone that understands all of this, we can help you get there so much faster. But give these a try because they'll definitely make a difference. So you'll want to hold here for probably a good minute, 2 minutes, 3 minutes. If you feel more, you can even turn your head a little bit more and hit those areas. If you feel like it's slightly lower, just walk your head down a little bit, like what I just did. Same kind of thing. Tilt your head a little bit more to that left if it's on the left side that you're noticing that you can't move. Now, here's one key that's different. Again, this is why an evaluation makes a key. When we take their head up and we rotate and we say, okay, you don't move, let's say to that left, where do you feel that? If they feel it on the right, we work on the right because that's what's stopping them from rotating that direction. So there are little things within evaluation that really do help us, help you get back there faster, but the suboccipital pad is a great thing that you can work on to start working out some of that tension. So now, if the next one's gonna be a stretch for the joints and the upper cervical. So what I'm gonna do is I'm gonna show you this on my left side. So I'm gonna lie down, and what we wanna do to kind of open up and stretch this joint up high here, we're gonna take our hand and we're gonna side bend our head away. So you take your hand, you side bend the head away, and then you're gonna take your other hand and rotate towards that left side, if it's a left side tightness. And then you can just breathe, and you'll feel it in that upper cervical spine. We're stretching that joint to open it up. Now, I'll give you another little trick that you can do. I'll have to do it on this side so we can get to the end of the table. But you can go and tilt the head off the edge just a little bit. Do the same thing, rotate, and then we can tilt the head back
a little bit more, and you're going to get a little bit more of a stretch doing it that way.
So those are the stretches that you can do with the suboccipital pad, as well as the stretch that I just did to open everything up. And then just kind of pay attention to your other symptoms to see if they improve. If you're noticing that it's not, or it's making things worse, then definitely you need to get in with someone that can really specialize in this to help you get back faster, because you could be doing it on the wrong side. This is where an evaluation comes into play with someone that really specializes this. Like a place like our place, so that we can help you get there and understand your body a little bit better. There's often other issues that go down into the neck and even into the ribs that we look at, so that we can get everything moving great. So again, if symptoms persist or are severe, get evaluated by a professional. Oftentimes this area needs some manual work to get you there faster. Your upper cervical spine could be a hidden key to your symptoms, and try these simple techniques, as they may be the first step to feeling better. Try it consistently for a week and see what the changes are. If this has helped, hit the like button and subscribe for more tips that can keep your body moving and feel its best. If you want to learn how you could actually work with us, go into the description and click on our free discovery visit if you live in the DFW area.